right, so, well, thank you, Wellbridge, for having us today. Hope to give you some information about heart disease prevention, and definitely have time for Q&A for whatever you guys want to learn about. So, obviously, February is Heart Month, and I'm a board-certified cardiologist. Did all my training down at St. Louis University, and I really focus on heart disease prevention. So, yes, I can take care of you having a heart attack, but it's my goal that you never end up in the hospital. And people ask me, what hospitals I'm on staff at? I tell them, but honestly, since I opened my practice up in August, I haven't stepped foot in the hospital to take care of a patient because none of my patients have needed to go into the hospital. That's my goal, is that none of them are going to end up with heart attacks. If they have heart attacks, we'll definitely take care of them in the hospital, but then they come back to me and we do the root cause analysis and figure out what's driving that. So I'm located right across the street in the Pierre Leclerc building. My practice is Apollo Cardiology. I launched in August because I really want to focus on getting to the root cause of what was driving cardiovascular disease. So as fun as it is to take care of people with heart attacks, not necessarily fun for the patient having the heart attack, but it's exciting and you immediately get to help them. It's a lot more rewarding to try to prevent that in the first place. So that's kind of what my practice is focusing on, is doing some other testing to really get to that root cause, or what's causing the vascular disease in the first place. So I'm also somewhat of a biohacker health optimizer. So people have questions about that at the end. We can talk about that. That's the reason I'm wearing these special blue blocking glasses. It helps with the filtering of the artificial light, so you can set your circadian rhythms. We'll talk about circadian rhythms in just a moment. But also top of mind, obviously, is one of the Blues players just had sudden cardiac death on the ice. A 36-year-old man, looks like he's pretty healthy, and basically died on the ice. If he didn't have immediate medical attention, he would not be here today. There's unfortunately over 300,000 Americans a year have sudden cardiac death. Their first sign that they have a problem is doing that. If you have no signs, you fall over dead. If you don't have immediate CPR, and he ended up needing a defibrillator or being shocked, 9 out of 10 people don't make it if they have sudden cardiac death outside of the hospital. And unfortunately, most of the events actually happen at home. So if you're going to get resuscitated, 7 out of 10 times it's actually going to be a loved one or a friend who's the one doing the CPR on you. So the goal is to never get to that stage. So what are the things they can do to know, are you at high risk or lower risk? There's a few. So everybody here has had their blood pressure checked, and likely their blood sugar and cholesterol. And you would know if you smoke or if you're overweight. Those are kind of the big 5 things that drive vascular disease, but there's 395 other things that can cause plaque to build up in your heart arteries. And some people here may have had a stress test, and the stress test is good if you're having symptoms. You're having chest pain, shortness of breath, exercise intolerance, or just fatigue that you don't explain in other ways. A stress test might be ordered by one of your doctors. Stress tests are really good at finding if you have a severe blockage, meaning one of your arteries is likely more than 70% blocked. But stress tests are not going to pick up the more minor blockages. The minor blockages are the things that majority of the time cause a heart attack. So you have a minor blockage, you're not going to have symptoms even with exercising, and these minor blockages are like a pimple on the wall of the artery. That pimple pops and a blood clot forms. Now you have 100% blockage of the artery, no nutrients are going downstream, that heart tissue starts to die. So you obviously want to get to the patient way before they get to that stage. And by the time you fail a stress test, you're likely looking at potentially getting stents or bypass surgery if you can't control the person's symptoms with medications and lifestyle adjustment. So that's always the key, is you're going to optimize their medical regimen and their lifestyle, but if you can't control the symptoms, that might be going on to have procedures to fix the blockages. So some of the tests that we do differently in our practice is we're big proponents of the CT coronary calcium score, or the calcium scan. It's a low-dose radiation CT scan, takes about 5 minutes. And it tells you, do you have any plaque building up in your arteries? It's really actually looking at if there's calcium in the walls of the artery. Calcium is supposed to be in your teeth and in your bones. It's not supposed to be in your arteries. So if the calcium's there, plaque is in the arteries. The higher the calcium score, the higher volume of plaque that's in the arteries. A score of 0, you're very low risk. Myself and Cassidy had a scan a couple weeks ago. Both of our scores are 0. I was expecting them to be 0. By the data, if your score is 0, your risk of a heart attack is about 0.4% over 5 years. Lowest as it can get. It's never going to be 0%. If your calcium score is over 400, that's a high-risk finding. Those are the people that need to be very aggressively treated for the other risk factors, and then potentially need a stress test to prove that they don't have a severe blockage in their arteries before they keep doing intense physical activity. Because it's usually intense physical activity or emotional stress that unmasks the symptoms. So the calcium score test, usually about $100 at many of the locations around St. Louis. You usually will need a physician's prescription for it because of it being a medical test that involves radiation, but most doctors are capable of ordering this test pretty easily. The hardest part is actually having a doctor that knows how to interpret the data and what to do about it. The other test that we offer in our practice is called the Carotid Intimal Medial Thickness Scan, or CIMT. It's an ultrasound of the neck artery, and many people have had carotid ultrasounds before. But carotid ultrasounds, the normal ones that you get at the hospital, are looking for severe flow issues in the arteries. Sometimes, if your doctor listens to your neck artery with a stethoscope, they might hear a bruit or abnormal flow in the artery. And that's what has you be sent off to get the carotid ultrasound. But the CIMT uses the same technology, but it's doing something different, where it's actually measuring the thickness of the wall of the artery. So if you think of your artery kind of like a garden hose, how thick is that garden hose wall? You're supposed to have a certain thickness as you age. As the artery gets thicker, there's more likely that plaque is starting to build up in the artery. So this test will tell you do you have the earliest signs of plaque building up in your artery, the soft plaque, even before it calcifies in your heart arteries. But this test also gives you a vascular age. So if you're a 50-year-old man and your arteries are 70 years old, that's a problem, because you're as old as your arteries are, essentially. So there are things you can do from a lifestyle, supplement, medication, regimen that can help stabilize any plaque that's in the arteries and ideally start getting the plaque to shrink down. And the third test that we offer is called an endopad. The endopad tests endothelial function. The endothelium is the inner lining of your blood vessels. It's 1 cell thick, but if you took out all your endothelium and laid it flat, it's about the surface area of 6 tennis courts. So that endothelium is basically the air traffic controller for what's in the blood lumen, where the blood is flowing, and the wall of the artery. If the endothelium gets damaged, stuff gets stuck up in the wall of the artery, and that plaque can continue to build up. So the endothelium will be abnormal approximately 6 to 7 years before the plaque starts building up. So if you find the dysfunction early, you have a lot of time to kind of reverse that dysfunction, and they don't end up ever putting the plaque in their arteries. The main thing that the endothelium makes is nitric oxide. Nitric oxide is a gas that dilates your blood vessels, helps things from sticking to the blood vessels like Teflon, and it lowers the blood pressure. So some of the things that really improve your endothelial function is what you do at Wellbridge here is exercise. Exercise is one of the number one things that improves nitric oxide release from your endothelium. The other one is being outside in the sun when UVA radiation's out there. So UVA radiation hits your skin, your blood vessels come up to the surface of the skin, they dilate, and your skin turns pink. That's your body absorbing UVA radiation, and because nitric oxide is getting released to dilate those blood vessels. And the third thing is, nutrition-wise, is mainly green leafy vegetables and beets. Both of those substances basically convert into nitric oxide through your saliva, through a pathway. So there's multiple ways you can improve your nitric oxide function, your endothelium function, if it's deemed to be abnormal. So those are the 3 tests that I typically will do if somebody wants to know what is their true risk of having a heart attack or stroke. If somebody's already had a stent, they've already had bypass surgery, the calcium score test is not useful for them. They're already deemed a high-risk individual, but the other 2 tests still can give you some information about what is your current vascular risk. Because you've already had some type of event, you may be higher risk, but the CIMT scan and the endopad will tell you, have you mitigated that risk and kind of cooled everything down, and you're not likely to have a second or third event. So we'll transition a little bit into what are the things you can do to prevent ever having that first heart attack. And I usually call it kind of a 4-legged stool. So the 4 legs are your nutrition, your exercise, your stress, and your sleep. And I'll save sleep for last because typically the sleep is the most important in my mindset. So nutrition, if there was a perfect diet for everybody would be doing the exact same diet. There's 300 to 400 diet books that come out every year. If there was one that was supposed to work, we'd all be doing it. So it's very individualized, and it's what your health goals are and what your, if you're trying to put on a lot of muscle, you're going to have to put on a different regimen than the average person who's doing it just for heart health. So you got to work with your doctor to kind of fine tune it. But some of the basics I typically recommend for patients are seasonal eating what grows in your local environment, because the sun grows the plants, you eat the plant, or you eat the animal that ate the plant. You need the match between what the sun is growing and what your skin is being exposed to. The easiest way to explain that is that, like bananas, they don't grow in St. Louis in January or February. Your body would have never seen this 200 years ago. Just because we have, worldwide transportation delivering the stuff to St. Louis doesn't mean your body's optimized to eat it this time of year if you're living in St. Louis this time of year. The sun can't grow bananas in St. Louis right now, so your body's not expecting those things in your system. So this is the type of year that you're gonna probably eat more protein, more fat, more keto-ish, because naturally you wouldn't have had a lot of carbohydrates. So seasonal eating for your local environment is very important. The other thing I typically will teach patients about is compressing the time windows of eating. So time-restricted eating, essentially a cousin of intermittent fasting. But time-restricted eating, there's a good book on it called The Circadian Code by Dr. Panda. 12-hour window. So your body has different clocks that turn on when either light enters your eyes or food enters your system. Your liver and gut are more programmed by the time that the food comes in the system. So water is fine 24 hours a day, but the first thing you put in your mouth in the morning that isn't water likely turns on the liver and gut clocks for the day. 12 hours after that time, you want to try to shut off those clocks. So if you're starting at 6 a.m., be done by 6 p.m., and try to give yourself 3 to 4 hours when nothing comes into your system other than water before you go to bed. Because you want those liver gut clocks to turn off so they can switch into repair mode. The other thing I typically recommend is seafood. Now, if you're allergic to shellfish, this is the caveat, talk to your doctor first before going down that route, but the DHA component of seafood is very important for optimal health. DHA is one of the omega-3 fatty acids. Your body can't make it, but it can recycle the DHA that it gets into the system. So you don't use DHA as a fuel. You use DHA as a way to transmit energy from your environment to the rest of your cells. So it somewhat acts like the insulation in a wire. So if you don't have enough of this insulation material, you can't transmit energy as effectively. So you might have like a half-charged battery. It'll work for a while, but not nearly as long as you want. And DHA, people ask, can you get it in supplement form? You can, but the better question is, should you? Probably not. You should get it in the way Mother Nature intended it to get into your system so you can use it that way. The other big thing for people who are frequent exercisers is, if you're trying to build muscle, resistance training is key for that, but the other thing is getting the right amount of protein to feed those muscles. So muscle protein synthesis happens when you get approximately 30 grams of protein into the system. And it's based more on blood volume than body weight. So barest minimum, you probably need at least 90 grams of protein a day divided up, 3 times. You may need more protein if you're trying to put on more muscle. Muscle is your metabolic currency. If you don't have muscle mass, you don't tend to age well. It's your metabolic engine. And it's also there for if you get sick, you break down muscle to repair things that got broken. My brother in the fall, very healthy, fit firefighter, contracted viral meningitis, ended up in the ICU for 4 or 5 days on a ventilator. He's very fortunate, he made a full recovery, but he lost 12 pounds of muscle when he was in the hospital. If he didn't have that muscle to lose, he would have had a whole long time to recover. So you want to maintain your muscle by doing what you guys do here, but also timing your protein to build it up. And if you want a good resource for that, Dr. Gabrielle Lyon, she's a physician in New York. She's an expert in muscle-centric medicine. She trained at WashU and did some geriatric training there. Then into the exercise component, probably the cardiologist can tell you, I'm not a huge fan of chronic cardio because you tend to wear yourself down doing a lot of chronic cardio. From my standpoint, compress the time in, and if you're healthy enough, do more interval type training because that's more evolutionary what you were designed to do. Push yourself hard and let your body recover and compress that into a 15, 20-minute workout from a cardio standpoint. But I really do focus more on the resistance training for people who come in off the street and say, I'm completely sedentary, I'm not doing anything. First start with walking just to get used to doing some type of activity, but walking alone is not a significant stressor to the system to get better. Yes, I want people to be active, but walking alone is not exercise. Exercise is a stress, and you have an adaptive response to get stronger and fitter, or your lungs can utilize more oxygen. So you need to push yourself harder and then recover. So I usually recommend patients start with resistance training because I want them to build up as much muscle mass as they can maintain. And I'm not a personal trainer, so I send people like you to come learn how to use the machines, do the classes, and figure out what's the best regimen for you and work around any limitations or injuries you have. Third thing I talk about is stress relief. Stress is ubiquitous in this environment. If you don't have enough components to decrease stress, things tend to wear down. Cortisol is the hormone that kind of wakes you up in the morning, but chronic cortisol will break down your muscles. It raises your blood sugar, makes your blood more sticky, more prone to causing blood clots. So dealing with your stress is paramount to long-term longevity. So you have a nervous system called the autonomic nervous system. You have a parasympathetic and the parasympathetic system. So the sympathetic is your fight or flight response. Your parasympathetic is your rest and relaxation. Many people get stuck in this high level of sympathetic tone. They always feel that, the heart's racing, they're under stress. Yes, if the bear is chasing you, you need to, I frequently also go to talk to firefighters, the tones go off in the middle of the night. You need that stress response. You need your blood pressure to rise. You need to be able to pump blood to your brain. You need to go. But the second that the call's over, how fast can you get back down to normal is key. There's many things that can help improve your stress, exercise being one of them, yoga, meditation, mindfulness, deep breathing exercises, and then if you're into technology, a device I frequently use for myself and patients is called HeartMath. HeartMath is a device that clips to your ear, and it does heart rate variability. Heart rate variability is the beat-to-beat difference between each heartbeat. The greater that heart rate variability, the better cardiac conditioned you are, and the better your stress response is. If your heart rate variability is very narrow, your body's under more physiologic stress. And I should back it up a little bit. I usually talk about this in the exercise component, but heart rate variability is a very good marker for if you're overtraining. So many athletes will use the chest strap, and there's some other watches that can do it as well, where you can measure your heart rate variability. Usually measure it first thing in the morning, get a baseline, and do whatever exercise regimen you're going to do. But if you start noticing that your heart rate variability is compressing, you might be overtraining. So that's a day you might want to do a deload, less stress on the system, and let your body recover, because exercise is outstanding, but if you chronically beat yourself up and don't let your body recover, you're not going to get the gains that you wanted to get and potentially do more harm long term. So sometimes I give the talk, I talk about Roger Federer versus Tiger Woods, both #1 players in their respective sports, but Tiger Woods broke down a lot in his career. He had multiple back injuries, and the story is that he had very poor sleep habits, would get up in the middle of the night, go work out, go run 5Ks, and just really didn't prioritize recovery initially. Federer's rumored to sleep up to 8, 9, 10 hours a day, and would take deload days. He would do what he needed to do, but he would recover. Federer had very few major injuries throughout his career. So it's kind of a marathon, it's not a sprint sometimes for those guys. And that will transition into kind of the fourth phase, or the fourth leg, is sleep. Sleep is the time that your body repairs itself. And sleep might have actually been the primordial condition where everybody was asleep and you evolved consciousness to go out and get more nutrients to become more complex. That's kind of a way out there kind of theory, but if you don't sleep well, you're not going to have great longevity. So sleep is when the mitochondria repair the damage that's been done throughout the day. So mitochondria are the things that make energy in your cells. The main things that have mitochondria, or I should say the places that have the most mitochondria, are your heart and brain. Those are the two locations that most people end up having diseases that take them out long term. So they get Alzheimer's, Parkinson's, they get heart disease. So if your mitochondria break, you can't make energy in that area, that system starts to fail. You start having brownouts in that area. So anything that you can do to help your mitochondria for your heart is going to help the mitochondria for your brain. And the mitochondria repair themselves at nighttime. It's not so simple as this, but they use melatonin as that fuel. So melatonin is a hormone that your body naturally makes in response to how you interact with light in your environment. So morning sunlight in your eyes starts the cascade. When you're inside under a bunch of artificial light, the artificial light has very intense spikes of blue light. That blue light destroys melatonin. So that's why I wear these glasses whenever I'm inside on artificial light or in front of things with screens. That blue light, basically pulls down your melatonin levels, and you don't have as much fuel at nighttime to repair the mitochondria. Your body doesn't release the melatonin until you have 3 to 4 hours of darkness. So if you use your devices right at the time you try to go to sleep, you might start to fall asleep, but you're not going to necessarily get good quality sleep, and the mitochondria don't do what they need to do. They basically recycle the broken parts at night, and then if some part's not repairable, they take it out. It's called apoptosis, or the cell dies, and then the good ones keep doing the work that they need to do. So you want to get rid of the bad ones, because if the bad ones persist, that is one of the triggers that can drive cancers, because the cell doesn't have the energy it needs, and cancer cells can propagate. So sleep is highly important. How much sleep? As much as your body needs. So people who are sicker, they need more time for that mitochondria recycling system to happen overnight. Healthier people probably need a little bit less sleep. There's a couple ways that you can monitor it, but two questions you can ask is when you wake up in the morning, scale 1 to 10, how well do you feel? If you feel that you got to keep sleeping for a couple more hours, you probably didn't get the deep restorative sleep or enough REM sleep to repair the system. The other thing is that if you feel that you must drink caffeinated beverages in the morning to start functioning, you didn't get enough sleep. And the other thing is if it's about 11 o'clock in the morning, you said, hey, I could go back to sleep right now, you probably didn't get enough sleep. So focus on getting more sleep the next night. It's really key to try to have a schedule on your sleep. Anybody here who has kids or grandkids knows that the kids running around, you're not going to pick them up, put them in bed, and say, go to sleep. There's kind of a wind down routine. You probably need to develop some kind of wind down routine for yourself where you mitigate using your technology late at night, start cooling down the house. 6 to 8 degrees or cooler in your sleeping sanctuary has been shown to help improve deep sleep. And then your sleep sanctuary should be as dark as possible. So blackout shades if you have light coming in off the street, and all lights in your bedroom should be basically off. If you need a light to get up to use the restroom at night, you really want to use a red light bulb or an amber light bulb because that won't affect your melatonin levels as much. If you have a bright white light at night, that can affect melatonin and affect your sleep quality, even if it's a small little night light on the wall. And then kind of the last thing I talk about sleep is, if you have a sleep disorder, you have snoring, you stop breathing, you have headaches in the morning, or you just feel that you've never gotten a good night's sleep, it's possible you have sleep apnea. Sleep apnea is the number one thing that usually affects people's quality of sleep. And you can be thin and have apnea. So if you don't feel like you're getting quality sleep, talk to your doctor about it, and they may recommend a sleep study. There's places where you can go for in-lab sleep studies, and now I think it's up to 6 out of 10 sleep studies actually happen at home. I have in my pocket a device that we use in our office. There's a device that looks like a watch, clips to your arm, clips to your finger, and there's a little wire here. I cut it because it was really long. The little wire has a little sticker here to your chest and watches your chest rise and fall. The finger probe's measuring the oxygen levels in your finger and some other metrics, and it basically will tell you how much desaturation or lowering your oxygen levels happened overnight. And also can tell if you stop breathing because the chest meter isn't moving. And if you stop breathing more than 5 times in an hour, you have sleep apnea that's at least mild. And weight loss is the number one thing that usually can cure mild apnea. But if it's more than mild, you may need CPAP, a mask, or your dentist can make a mandibular device that pulls your jaw open to let the air back down. Because sleep apnea, because of the lowering the oxygen levels, that puts a lot of stress on the heart because the oxygen is needed to burn the fuel in the mitochondria. Your mitochondria are like carburetors. If they don't have the right oxygen mix, they don't burn your fuel effectively. The other thing is when you stop breathing, you're putting tremendous stress on your heart as your airways are trying to open back up to let you start breathing. So the heart's getting kind of squished a little bit when you do that apnea spell. So if you have any concerns about that, talk to your doctors about, if you need to get tested for sleep apnea. So in review, there's 3 tests we typically recommend for patients who want to know their true risk of a heart attack. It's the CT coronary calcium score, a carotid intimal medial thickness scan, and an endopat. And then the 4 areas that, from a lifestyle standpoint, that don't require pills or procedures, is focus on the timing of your nutrition, seasonal eating, exercise, mainly resistance training, work on your stress, however you like to work on your stress levels, and then really optimize your sleep. Those are the keys to longevity, because if you can mind your mitochondria, you can really reduce the risk about 80% of chronic diseases. So thank you guys for your attention today, and we'll open up to any questions that you have.
We were talking about normal heart attacks, i.e. the beating stops. What about atrial fibrillation?
What specifically about it?
Because the heart usually beats, but it doesn't beat in the same way. It's not clamping and releasing and clamping and releasing. So do the processes that you were just discussing about what to watch, the sort of fasting program, time fasting for eating and all of that. Does that impact atrial fibrillation, or is AFib just a much different animal?
So atrial fibrillation is a very common disorder as people age. Atrial fibrillation, for those that don't know, happens when the top chamber of the heart is beating very irregularly. It's beating 300 to 400 beats a minute, but the bottom chamber, the ventricle, does not want to beat that fast because you can't effectively pump blood that fast. So that's why your natural heart rate is typically 60 to 100. So there's kind of a relay switch between the top chamber and the bottom chamber that blocks that real fast message from the atrium. The major risk of atrial fibrillation is stroke, because as that top chamber is quivering, blood can coagulate up there, and if that blood clot breaks free, wherever it goes causes a problem. And the first stop on the highway is the brain. So atrial fibrillation is an electrical problem, where coronary artery disease is more of a plumbing problem. But many of the things that can help reduce the risk of a heart attack help reduce the risk of atrial fibrillation. One thing is sleep apnea. Sleep apnea is highly correlated with atrial fibrillation. So any patient that already makes it to my door that has atrial fibrillation, I'm always sending them out to get evaluated for sleep apnea, because if sleep apnea is present, you treat it, the atrial fibrillation burden is likely going to be less. Anything that can lower inflammation will lower atrial fibrillation. So I do a very comprehensive blood work panel. I didn't really discuss it today, but checking many different markers of inflammation. You want your immune system turned on when you have an infection or you have an injury, but if your immune system's always turned on, that chronic inflammation can damage your arteries, but it also makes those atria more likely to quiver. So things that lower inflammation is, optimal nutrition regimens, dealing with stress, exercising, all those things help lower inflammation, so you're much less likely to have atrial fibrillation in the first place. Yes, ma'am.
So what do you look for in that blood panel? I was diagnosed with an elevated lipoprotein A.
Okay.
That was sort of an accidental finding.
Sure.
And I'm wondering why things like that aren't in the usual panel test. What's in your panel?
So great question. So the question was about lipoprotein A. Lipoprotein A is a substance very similar to LDL. So I should back up a little bit. I'll give you the quick 5-minute primer on cholesterol. Cholesterol is a substance that every cell in your body needs. You use your cholesterol to make your cell membranes, the outer shells of your cells. You use to make it to your bile acids to digest your fats. You use cholesterol to make your sex hormones. So without cholesterol, you do not exist. Mother Nature or the universe or whatever you believe did not put cholesterol into your system to give you heart attacks. If your body is inflamed for whatever reason, so you're eating a very poor standard American diet and lifestyle and you're sedentary and you don't sleep well and you're highly inflamed, that inflammation damages the cholesterol, and it's more that damaged cholesterol that gets stuck in your arteries and starts building up the plaque. So cholesterol by itself isn't the problem, it's the damaged cholesterol. And cholesterol is this waxy substance. It doesn't float in the blood, so it's like oil and vinegar. So it uses a particle, these lipoproteins wrap up the cholesterol and transport it around the system. Lipoprotein A is very common in 20% of the population. And it's an increased risk factor for a heart attack or stroke because it makes the blood more sticky, more likely to clot. Evolutionary, 20 million years ago, I shouldn't say 20 million years ago, but a long time ago when humans were disevolved, LPA helped people not bleed to death, essentially. So it's kind of a holdover from that time frame. But now, if people are leading the wrong kind of lifestyles, LPA can promote clotting and atherosclerosis or plaque buildup. It's not included in the standard lipid profile. For what reason? I don't know exactly why. It's about a $20 test. And everybody, honestly, should be tested for at least once. If your levels are high, well, there's many things you can do that help lower your risk. Right now, there's not great data that if you give a supplement or medication to lower lipoprotein A, do you lower that person's risk? We just know that they're at higher risk if they have it. So try to fix everything else. Make sure they don't have any inflammation. If their LDL particle number is very high, try to get the LDL particle number down. So it also sort of depends on, what is their atherosclerotic burden. If they have a calcium score of 0 and a CIMT that is low risk, yes, they have lipoprotein A, but it's not causing a problem. The gentleman who is on The Biggest Loser, Bob Harper, who had his sudden cardiac death at the gym, he had lipoprotein A. He had a plaque rupture in his artery, got a stent, survived, but lipoprotein A was likely the driver for his event. From the outside, the guy looks, very fit and healthy, but I don't have access to any of his blood markers or know anything else about his, history, but that's why I say that, just looking at your blood pressure, your blood sugar, your regular cholesterol isn't enough. You need to know how healthy are the arteries, and then you go looking into these other things. So there are other companies that do these advanced lipid panels where you're looking at lipoprotein A, you're looking at the lipoproteins that carry the cholesterol around, you're looking at different inflammatory markers, CRP, myeloperoxidase, LPPLA2, fibrinogen, oxidized LDL. You're looking at how the body's responding to what's going on in the environment. But I check full thyroid panels, including free T3, free T4, thyroid antibodies, make sure your body's not attacking your thyroid, full, kind of metabolic workup to make sure you're not pre-diabetic or insulin resistant. And then there's a whole host of other markers, depending on what people's risks are, we take a look at. Yes, sir.
I've read so much about aspirin and statins,
Okay.
both sides of the question. What are your feelings on that?
Which one you want first?
Aspirin, I guess.
Okay, so questions about aspirin. Aspirin prevents the platelets from sticking together. So when you get a cut and the scab forms, that's the platelets, forming kind of a bridge to prevent continued bleeding. So when one of these plaques on your arteries ruptures, the little pimples on the arteries, the damaged cholesterol that's stuck in there and a bunch of other things from the immune system spill out into the bloodstream. The body thinks, oh, I have a cut, I'm going to bleed to death, and forms a clot there to kind of seal it off. So the body's responding naturally to it, but unfortunately, it's sealing off the rest of the artery from its nutrients. A lot of that clot is platelets, and the aspirin basically prevents those platelets from fully sticking together. So sometimes we use analogies like it tries to keep your blood more like red wine, less like ketchup. So aspirin is not a everybody should take it type of substance because there's a risk of bleeding with aspirin. So depending on your personal health history, you have stomach ulcers or you're allergic to aspirin, you're not a candidate for aspirin. If you're a younger woman, the benefits are not likely there. The risk of bleeding outweighs the benefits. So I will use these advanced lab testing to figure out, do you have a lot of inflammation and fibrinogen, and you're more likely to be somebody who clots. If you have a high calcium score, typically over 100, over 400, or you've already had a heart attack, you've already had a stent, you've had bypass surgery, you're a higher risk individual. You're trying to prevent recidivism or second events. Aspirin has been clearly shown to reduce events in that population. So that's pretty much unless the person has a known side effect, major bleeding complication from aspirin, they should be on aspirin to reduce their risk. But a younger person, they probably would want to go through some testing to see, are they even at risk? So aspirin is very individualized. So I agree, it should not be every single person over the age of 40 should be taking aspirin. It needs to be more targeted. The other question about statins, it falls along the same lines. Statins are tools. The people who benefit most are people who've unfortunately already had events. They've had heart attacks, strokes, stents, bypass. Statins help reduce further events, but the way I tend to think about more statins is probably a bit more nuanced in that, yes, it lowers cholesterol, but the bigger thing that it probably does is that it lowers inflammation, and then any plaque that is present in the artery already, it's stabilizing the plaque. Because I honestly don't care what your cholesterol is per se. I care, do you have heart attacks? Do you have strokes? Do you, die from these type of events? And statins in certain populations have been shown to reduce those risks. So I will use those tools when I know that the risk outweighs, the benefit of it outweighs any potential risk of being on statins. And the main risk of the statins, for the most part, is muscle aches, pains. Sometimes it affects blood sugar, certain statins more than others, and it can affect memory in certain instances. So typically if I start a statin somebody, I tell them, listen to your body, because if I give you a list of 800 possible side effects, you might have 799 of them, I might tell you what all of them are. But if I tell you, just listen to your body, if it feels off, stop whatever medication, let your doctor know, and if the symptoms go away, then it definitely was probably that medication. Sometimes we will still re-challenge somebody with a different one to see do they truly have that effect or not, and some people truly are statin intolerant and they can't tolerate them. But there's other things that we can use if people are statin intolerant and at higher risk. But again, it's very nuanced. Cassidy here, calcium score of 0. If her cholesterol is high, I would work on lifestyle and supplements before reaching for statin because the data in younger women in statins is not very strong for people who've never had an event. So again, use advanced lipid testing and then look at their arteries. Do you have a lot of plaque? Statins may have a benefit. Your calcium score is 0. The statins are probably not likely to help. Work on their lifestyle. Yes, ma'am.
Do you advocate any supplements because most of us don't have a very good diet?
So that's again a very good question. So the word supplement, it's supplementing something that you're not getting in your lifestyle, your nutrition, your exercise. So typically it's going to take blood work to figure out what you're deficient in. So you want to use targeted supplementation when you need to. But I've gone away from just switching up taking prescription medications and taking the same thing in the number of supplements, because there's something in your environment that's not working if you need to take 10, 12 supplements to survive. So the number one thing people are mostly deficient in is honestly sunlight. So they need more sun supplements. So if you're living inside 90% of the time, your body makes hormones off kilter. You make neurotransmitters off kilter. So seeing the sunrise, being outside more times of the day so that your body's GPS clock keeps getting reset tends to help regulate a lot of things, and you won't need as many supplements. Yes, sir.
So you're speaking of sunlight. How dangerous or good is it to get exposure to sunlight in terms of skin cancer and other things? Because there's a lot of concern about, you got to put on SPF 50 or something before you go out. Is it a good idea to get a lot of exposure to the sun, or does it cause problems?
That's an outstanding question. The sun was here millions of years ago. Human beings evolved under the sun, and without the sun, you will not have longevity. There's an epidemic of vitamin D deficiency. You cannot supplement your way back with a pill or drinking 6 gallons of milk, because literally you would have to drink about 4 to 6 gallons of milk a day to get your vitamin D levels up to optimal. You need the sun to do that. The sun is turning cholesterol that your body's making, which majority of your cholesterol is your body's making it, and it's turning it into vitamin D. You need sunlight to catalyze that reaction. There's a great app called D-Minder. The D-Minder app is free. It tells you what time of day to be outside that you can start making vitamin D on your skin. You're a solar panel. So the more skin that you're exposed, the better you can make the vitamin D. People have different skin types, so if you're a fair hair, blonde hair Irish person, you probably need a whole lot less sun than somebody who's African American and has very dark skin. Those people probably need 5 times more sunlight if they're very dark. So it's very tailored to what your skin type is. And it also depends on what your current solar callus is. If you are 90% inside and then you head down to Cancun this time of year and you pop outside only at noontime, you're going to fry because your skin is not preconditioned to that high levels of UV light. So you got to work your way up. And one of the best ways to do this is seeing a lot of morning sunlight. The morning sunlight does not contain any UV radiation. That morning sunlight preconditions your skin for when UV radiation comes out later in the day. So your body's better able to absorb it. All-cause mortality is increased with low vitamin D levels. So almost every patient who has a malignancy, a cancer, an autoimmune condition, always has low vitamin D. If you need sunlight to make vitamin D, it goes into the reason that if you have higher vitamin D levels, you're not likely to get as many cancers or autoimmune conditions. So use the sun wisely, use apps to kind of build up the time frame, and then you can absorb more light without burning. But to your question about skin cancer, yes, skin cancer is a worrisome thing, but heart disease is 20 times more common than skin cancer is. So if you hide from the sun all the time, you're much more likely to get a heart condition than you are skin cancer. And then I get asked the questions, what about sunscreens? Personally, my opinion is if you would not eat it, drink it, you should not put it on your skin because your skin is going to be absorbing it. Certain sunscreens are endocrine disruptors. You make your hormones off kilter, and you also have certain things that cause some other issues. So I don't personally recommend hardly any sunscreens. The best sunscreen is build up a slight tan, but then once you've got enough sun for the day, make like the animals, go in the shade. You don't see dogs, cats laying out the sun for 24 hours a day. They go under the shade, go under a cabana, wear a hat, wear clothes that block sunlight. That's the best way. Wear physical blockers. If I was stuck on a boat in the middle of nowhere and you're getting 8 hours of pounding sun, would I wear a sunscreen? Possibly at that point, but I would only probably wear the actual physical blocking sunscreens, like the titanium and zinc oxides, because it will reflect the UV light and not necessarily get absorbed into your blood system. But but great question.
So
Yes, ma'am.
everybody's in on advertisement today. At least if you go to a physician, they'll give you some brochures to read, and you read them, and so newspaper, magazines, television, everything. So they'll say 6 ounces of mushrooms are good for your brain, and blueberries are good for your eyes, and this is a no-no, and beets are good. And so how the diversity, how do you round that out? Because A, B, and C, I'm already there, and your endorphins get going when you are outside.
Mm-hmm. So it's a good question because, I mean, there's, I probably, 6-7 years ago when I was first getting into this more integrative functional medicine, you read an article, you read a paper, or see a study, and you're like, oh, this supplement or this food stuff is good for me. I added it into my regimen. Keep adding it in. Eventually you're on like 20 supplements, you're eating all these fancy foods from all over the world, and do you necessarily feel better? So listen to how you feel and what are your biomarkers looking like. If your biomarkers look good and you feel well, do you really need all these things from all over the world? Because if you actually step back and think about it, like 150 years ago, if you couldn't walk outside, pick it out of the ground, pick it from a tree, or kill it, or fish for it, you didn't eat it. So you're tailored to eat what's in your local environment. Humans evolved to eat various diets. If you're living way up north, you're an Eskimo, you're eating basically keto because that's the only thing that's up there that time of year. You're eating more fat. If you're living on the equator, there's, the bananas grow 365 days a year on the equator. You basically need the match between what's going on in the environment and what's going on with where the food is growing. So that's kind of that's going back to the seasonal eating part of it. But about the endorphins, you're exactly right. There's a substance called POMC, P-O-M-C. It's made in your eye in response to light from the morning time. That POMC has a beta endorphin in it. That's similar to the runner's high that you get when you're exercising, but sunlight is there to basically make you addicted to it so that you will absorb it and get the things that your body needs to do with sunlight. Yes, ma'am.
So what do we do when it's gloomy day after day after day in St. Louis?
That's a great question. 2 things. One is, yes, when it's cloudy, it's likely to block UV radiation at that time of the day. So there's about a 2-month window in St. Louis. There's vitamin D winter. Even if you had no clothes on and you're outside, you're not making vitamin D in St. Louis. So the goal is you build up your vitamin D through the summer and to the fall, and then your levels naturally dip down through the winter time. This is the reason why influenza and all these other viruses are much more common in the wintertime in this hemisphere, because people's vitamin D levels go down, their immune systems aren't as tuned in, and they get sick. So build it up in the wintertime. But there's still beneficial wavelengths of light, even if you can't make vitamin D this time of year. Red light is outside from sun up to sundown. That red light helps regenerate certain processes in the body. So even if it's cold out, you still want to be outside with as much skin as you can, tolerate. And as Cassie knows, I've kind of cold adapted over the past year or two. So you can train yourself to be able to tolerate the cold for a few minutes without injuring yourself. There's a lot of data that if you can, learn how to do cold thermogenesis or cold therapy, it really lowers inflammation, you recover better. But it's not for everybody, and you usually need somebody to kind of coach you through it how to do it. But even if it's cold out, you want at least to have your eyes out to the sun, because that sunlight is programming your brain to make hormones the right way throughout the day. But the other thing I should say is too, is you probably can tell I'm fairly bronzed right now, is if you have the means and the time, is you leave St. Louis in the wintertime for a week, literally go somewhere where it's warmer, recharge your batteries. It literally is charging up your mitochondria. And then you come back to St. Louis and for the most part have a 4 to 6 week pop in your energy levels when you do that.
How much exposure to the sun do you need to get adequate D levels?
Probably at least 15 to 20 minutes, depending on your skin type.
Oh, okay.
Yeah, if you're an African American, really dark, you probably need 2 hours a day. And so, but it always depends on, what your exposure to sun has been. I mean, like I said, I'm fairly bronze right now, but I didn't look this way 6 months ago. I had to kind of slowly work this way up. And now, was sitting on the beach in Puerto Rico last week with some friends doing some education consults on the beach, which is kind of my goal, is to teach people outside instead of inside. I could stay outside for 3-4 hours and I don't burn at this stage, but I had to build my kind of callus up at this point.
Do the SAD lights do anything for that?
It's a great question. So seasonal affective disorder is extremely common. I've seen data that's up to 5% of the population. I think it's probably actually higher than that. But seasonal affective disorder, for the most part, is 100% driven by the lack of natural sunlight that people are getting exposed to in the wintertime. So the SAD lights are very intense light boxes. It helps, but it's not always sufficient, because even the best light box is not nearly as powerful as the sun and the intensity. It's called lux, or LUX. So I have an app on my phone, I think it's called My Lux, and it uses the camera on your phone, and it tells you what the light intensity is. So your eyes can sense this intensity of light. It looks like it's the same brightness, but this will be 300, and you go outside and it's multi-thousands. And so if you're in St. Louis in the wintertime and you're always inside, you don't get that light intensity as much. So the SAD lights help, but you still need the sunlight to really improve it. But seasonal affective disorder is extremely common, and you can do everything you can with the lights, but I can tell you from personal experience, ultimately it sometimes takes going further south and rebuilding yourself for a little bit and coming back.
Well, then would you use the satellite only during the day because of the circadian rhythm situation and the buildup of the internal?
Correct. So the satellites optimally would be used when sunrise happens, because you want to simulate the body's response to the blue light that comes from the satellite that raises cortisol, but it's not a perfect solution for what sunlight can do.
Thank you.
Yes, ma'am.
I'm just curious about, there's testing for like colonoscopies at certain ages, mammograms at certain ages. I mean, is there a certain age that, people don't just go to the doctor and say, check my heart. At what point, or is there an age that you're supposed to, like all this testing you're talking about, is like, who goes and does that? I'm just curious.
It's a great question. As there are guidelines from different organizations. Some of them compete a little bit. So for the calcium score test, typically it's men over 45, women over 55. But if you have a family history where your mom had a heart attack at 52, you want to do at least 10 years earlier than any family member, so you can try to find stuff much earlier. So even though the guidelines say 45, I for the most part would use 40ish to start the thinking about it. I've scanned people in their late 20s who had a very crazy family history. Mom and dad both had heart attacks in their 40s, and we want to start much earlier. But the average person is probably 40ish. They should start considering it. I'll throw it back to who would have suspected a 36-year-old NHL player is going to have sudden cardiac death in the eyes? The guy looks perfectly healthy. I'm not saying that we would have necessarily picked it up. It's possible, but 40 is a pretty nice cutoff to start at least thinking about looking at it. And it's mostly, this is why I'm going out to the community to talk about this, because this isn't stuff you necessarily hear from your conventional trained doctors, because this isn't stuff I necessarily learned in my traditional training. I went to multiple courses and have taught myself this stuff over time, because conventional medicine is outstanding if you're having the big heart attack or you're in a trauma situation. The hospital's going to put you back together. But hospitals aren't necessarily situated to make you have optimal health. That's more going to be on you. And as a conventional doctor, I didn't get a lot of training on how to do that. I had to go to other courses and teach myself over time. So, your health is your best asset. So I've spent a lot of time, money, and effort learning about how to optimize my own health, and now I'm sharing it with others. Yes, ma'am.
Sunglasses, they all block everything. You're not supposed to wear them.
That's the correct answer. Yes, you're not supposed to wear sunglasses. Now, I can tell you I was a sunglass addict up until about 2 years ago. I have very light blue eyes. That's usually a sign that somebody in my ancestry was needing to assimilate more light, because the lighter your irises are, the more light is able to get into your eyes. But lighter eyes are more sensitive to light. And so I used to, if I walked outside on a bright day, like instant tearing, I couldn't see. So, even in the wintertime, sunglasses on. So over about, I don't remember exactly if it was 2 weeks or less, but essentially over a 2 week period, I weaned myself off sunglasses, and I haven't worn them since. I've been to Mexico a couple times, in Puerto Rico recently. I wear sunglasses the entire week, outside the entire time. Sometimes, put a ball cap on or something like that, or sit under an umbrella, not get full sun in my face, but your eyes are programmed to all the wavelengths of light. And if you wear a filter over them, it's equivalent of trying to grow a plant with a tarp over it. It's not going to work as well. So you need the full spectrum of light into your eyes. Now there's caveats, if you're driving and actually can't see what's in front of you, wear your sunglasses. If you're out on the water and the water, is reflecting light straight in your eyes, wear your sunglasses. But the majority of the time, you want to be getting full spectrum light into your eyes. The reverse is, these glasses, I basically sometimes call these indoor sunglasses. So no glasses outside, indoors, always have glasses. The key time for sure is once the sun sets. Evolutionary, you would have never been exposed to really intense light. You would have only had candlelight or fire. You wouldn't have had this bright white light that simulates the sun. Your screen is basically the sun. If you're looking at it at 9 o'clock at night, it tells your brain it's noontime. So if you wear glasses, you can make the melatonin be released on schedule. So indoors, I'm wearing these all the time, and at nighttime I have a darker pair, which really kind of gets you ready for sleep.
So, I'm sorry I may have missed this, but you're saying that all the spectrum of light needs to come into your eye? What is it? Is that for sleep or something else?
It's for everything. You have different receptors in the eyes. You got one that senses blue light. You got one in your eye that senses UVA light. And if you're wearing glasses or sunglasses, these things filter out certain of those wavelengths. So those receptors don't get activated. So you don't make certain hormones effectively. Yes, you have certain of those receptors on your skin, but most people's skin isn't covered up, so they're not getting the message on your skin either. So the eyes are the most important of the kind of light sensors, and so you want to follow what Mother Nature did. So humans are only things in the universe that put stuff between their eyes and the sun. Every animal out there is always under full spectrum light.
The reason we wear sunglasses or we're told to wear them is because cataracts or whatever.
So
Is that a concern?
it can be a concern, but I can tell you, I would look, if you're really interested in some of the data, there's a book called Health and Light by John Ott. Explains some of the side effects of wearing glasses. But cataracts is the process where the lens starts turning cloudy. One of the theories is why it's turning cloudy is it's trying to protect the eye from too intense amount of blue light. So cataracts are getting more common as people use more technology with screens. Your screen puts out 4 to 5 times the amount of blue light than the sun does. The sun's blue light is always balanced with red light and other spectrums of light. So one theory is that people are getting more cataracts because they're using more screens. So the lens starts getting cloudy, basically is turning into natural sunglasses to prevent that light from getting to the back of the eye. So the more troublesome question, and I don't have an answer for exactly, is if your cataracts get so bad and you're contemplating getting lens replacements, what do you do? Right now in the US, there are no intraocular lenses that don't block all UV light and most of blue light. So you're basically putting in sunglasses into your natural eye when you get cataract replacements. In the olden days, before they had these lenses, they just took the lens out and you didn't have a lens anymore. That's basically what happened to Vincent van Gogh. He had cataracts, they took them out, and that's the reason why hay fields or haystacks or whatever that painting is that looks all wavy and crazy, is that when he took the lens out, humans can actually see certain wavelengths of UV light. And so he was seeing the UV light around the things he was painting. That's why the painting looks that way. So,
That is fascinating.
yeah. Yes, ma'am.
Do you have any sleep tips? So that would apply to waking up after, like I can go to sleep just fine and I can try many of the things you suggested. When I can't sleep at night, which has been a long-standing problem, I listen to audio things on my iPad. So obviously I'm looking at my iPad, which clearly is a big no-no. But if I don't do something like that, I have a really hard time getting back to sleep. Do you have any help to offer?
So, obviously it's going to take a lot of, make sure you're optimizing your sleep hygiene and sleep environments. The number one tip is morning sun, the sunrise is the number one thing that sets your circadian clock, your 24-hour cycle for the day. So seeing the sunrise is the thing that optimizes your sleep. And you might, if you're somebody who's waking up at 9 o'clock, you're not going to be seeing the sunrise initially. You're going to have to work your way back. But having a set wake up time and bedtime 7 days a week is key, because if you switch up the cycles and sleep in 2 hours later on the weekend because you feel like you're catching up, you basically jet lag yourself. It's called social jet lag. And then your body's having to try to catch up the rest of the week. So you have this vicious cycle. So trying to get down to a regular wake up and sleep cycle. And the best way to do that is really to kind of try to ultimately build your life around the way the sun rises and sun sets. You eat when it's bright out and you sleep when it's dark. That's kind of the two quickest tips. But seeing the sunrise when you're inside, block as much artificial light as you possibly can. There's different manufacturers of these blue blocking lenses. And then in the evening time, start mitigating your technology. So if you're using technology, there's, at least on the computers, there's Iris and Efflux. They're systems that dial down the amount of blue light that comes out of your screen. The iPhone has night shift mode, and the Droid has, I can't remember what exactly it's called, but the Droid phones have a setting where you can kind of dial down some of the blue light. But your bedroom really needs to be set up as a sleep sanctuary. It's a place that you're going to sleep. So I usually tell people the only two things that should happen in your bedroom is sleep and sex. TV, reading in bed, anything that conditions your mind that you're not getting rest, you want to eliminate from your bedroom. So, if you're laying in bed and you just absolutely can't sleep, it's best to get out of bed, go somewhere else where it's still, dimly lit. So you want to have red lights, amber lights, put on your glasses, and read a paper book until you're tired enough to go back to bed. But you want to condition yourself that when you're in your bedroom, your body's there to repair itself.
So you're saying sunrise, but sunrise changes time frame
Correct?
across the course of the year. Are you actually saying, do you actually need sunrise as opposed to the time you rise?
I mean actual sunrise.
Okay.
Yeah, today was 6:42. I have not missed a sunrise on purpose since the beginning of 2019.
So then what you're doing is you're expanding the amount of daylight because sunrise gets later and then gets earlier, and sunset has the same opposite action. So you can't really, you can set yourself up for when you wake up, but then going to sleep at the same time every night isn't necessarily going to give you the same amount of sleep each night.
Correct. So it's a guideline. Typically in the winter, you're actually going to sleep more because it's more time for darkness. So, but with the technology people have, they simulate daytime 24/7, 365 days of the year. So they're trying to make an environment that their body's not naturalized to. So if you go out camping, you go out on a boat, and you're outside, sunsets, you're usually tired within 2 to 3 hours, and you're getting ready to wind down. No matter what hour it is, you can look at your watch, oh, it's 8 o'clock, or, So typically in the summer, you're probably going to be up more, but you really want to live around, the sunrise and sunsets.
Thank you. Thank you. This was very interesting and informative.
You're very welcome.
Good.